Hello, everyone. My name is Matthew Webb, and I'm a student physical therapist with a CSCS and a BS in nutrition science. Today, I'm going to be talking about pyridoxine or vitamin B6. This is going to be the fourth in a series of educational videos intended for healthcare professionals to help us in direct access healthcare fields become more adept at identifying nutritional deficiencies so that we can get patients presenting with one of these diseases the help that they need. Today, we're taking a look at pyridoxine, or vitamin B6. So, first, we're going to go into the very basics behind deficiency of pyridoxine. Then, we'll break down the science behind why patients are presenting the way that they do. Then, I'll give you some key takeaways to help you identify this disease. When a patient has pyridoxine disease, deficiency, you may find integumentary and neuro signs. And we'll go further into the science behind these presentations and the risk factors later in this presentation, but I just wanted to provide you an idea of what we're going to be getting into in this lecture right here. Here's the overview slide with the mechanisms we'll be covering. We'll talk about pyridoxine's role in the methionine cycle, which during pyridoxine deficiency can lead to the same collagen cross-linking issues that we went over with riboflavin. Then we'll take a look at pyridoxine's role in myelin synthesis and GABA synthesis. So, as the slide says, pyridoxine is required to turn homocysteine into cysteine. That means during pyridoxine deficiency, homocysteine levels will rise. As we learned from the riboflavin video, excess homocysteine leads to homocysteine thiolactone, impairing collagen cross-linking. This can lead to our collagen not becoming its stable and insoluble form, which, just like riboflavin, means that those moist environments in our skin, such as around the lips or like our armpits or something like that, are more prone to break down. All right, GABA. GABA is an inhibitory neurotransmitter, so it has the ability to calm down excited neurons, so to speak. Deficiency of GABA can lead to hyperexcitable neurons, excitotoxicity, which can cause cell death, and increased incidence of neuropathic pain as well as neuropathies. Pyridoxine is also necessary for some myelin structural molecule synthesis, such as sphingomyelin. If sphingomyelin is not regularly synthesized, then myelin can break down, which of course can also lead to neuropathy and muscle weakness. Here are some risk factors you can look out for. Alcoholism impairs pyridoxine absorption due to intestinal damage. Pyridoxine is used up in alcohol metabolism. Alcohol acts as a diuretic, increasing urine production, thus increasing pyridoxine excretion. Celiac disease is another risk factor because it causes intestinal damage and decreases absorption. This disease also requires a gluten free diet, but wheat products are fortified with pyridoxine, which means a major source is unavailable to these individuals. Hepatic or renal diseases can impair pyridoxine metabolism and or excretion. As far as drugs go, anti-tuberculosis drugs such as isoniazid, pyrazinamide, and ethaniamide can increase the risk of pyridoxine deficiency because the active ingredient can directly bind to pyridoxine, preventing it from performing its function. Anti-anxiety drugs can bind to pyridoxal kinase, which is an enzyme that converts pyridoxine to its active form, leading to functional deficiency. Anti-asthmatic and COPD drugs, theophylline, acts as a competitive inhibitor of pyridoxal kinase, which can lead to a functional deficiency of pyridoxine. Some subjective questions you could ask would be about past medical history, and you should make note of celiac disease or hepatic or renal diseases. Ask what medications are they taking. Make note of anti-tuberculosis or anti-anxiety, anti-asthmatic, or COPD drugs. Ask about any alcohol consumption, and of course, find out what that alcohol consumption looks like. Pyridoxine deficiency is very common in people with severe alcohol use disorder. Some other diseases that individuals can be at greater risk for with pyridoxine deficiency are anemia, specifically sideroblastic anemia, colorectal rectal cancer, and iron toxicity. For clinical exam in the integumentary system, findings that would be observable include chelosis, which is swollen slash inflamed lips, angular cheilitis, which is angular cracking at the corner of the lips, a scaly rash and sores similar to what you might see in niacin deficiency could also be visible. Oral findings would be observable, such as a swollen and red tongue that's called glossitis, just like I have told you with niacin deficiency and probably a few others. Neuro findings would include peripheral neuropathy. Just note that this is usually a later stage of the deficiency disease that appears after the integumentary findings. The main takeaways as far as the what, why, and how behind the presentation is that the integumentary system and nervous system can be impacted. The integumentary system is characterized by chelosis and angular cheilitis due to collagen being inhibited from becoming its mature insoluble form. Pyridoxine is also required to allow homocysteine to become usable in the citric acid cycle. Homocysteine has a derivative called homocysteine thiolactone, which can bind to where the aldehyde functional groups on collagen should be, which can physically prevent cross linking. High levels of homocysteine can also downregulate the gene that transcribes the mRNA necessary for LOX production. Again, that's related to collagen. Both these things can lead to collagen being inhibited from becoming its stable, mature form. Instead, collagen fibrils will become relatively structurally disorganized and fragile. Pyridoxine deficiency can also cause neuroscience. This is because what is often considered its active form, PLP, is utilized to create some myelin structural molecules such as sphingomyelin. It's also required for GABA synthesis, an inhibitory neurotransmitter. Without sphingomyelin regularly being synthesized, myelin will break down, which can lead to neuropathy. GABA deficiency can cause neurons to become hyperexcitable and potentially cause excitotoxicity, which can, of course, lead to cell death. Thus, neuropathic pain and neuropathy can be potentially caused by this deficiency. And here are my resources. Thanks for watching. Note that I am making these presentations during a pretty busy semester, so I'm liable to have made some mistakes. If so, let me know in the comments, and if your correction checks out, then I'll either add it to the video description or I'll pin your comment. If you learned something from this video and you want to learn more, continue on to most likely folate or vitamin B9 video. I'm still considering doing a vitamin B7 or biotin video because it has some cool biochemistry. However, the main reason for biotin deficiency is something called biotinidase deficiency, or BTD. Biotinidase is a key enzyme in the biotin cycle necessary for recycling biotin for reuse. And one in every 60,000 people is born with a mutation of the BTD gene, which codes for the enzyme. Most countries, however, already test for the genetic defect at birth, and if the person has it, then they'll just medically manage it. It's a cool vitamin though, so if I have time this semester, I'll make a presentation for it, but without including biotinidase deficiency cases, biotin deficiency will be pretty rare. And if someone has it, then they'll probably have other B vitamin deficiencies, and since you watch my videos, you'll be more than equipped to catch those. Then, when their primary care provider has the testing done, they'll discover the biotin deficiency on top of it all. And you still did your job. Way to go. So, most likely look out for folate or vitamin B9 video next. And maybe I'll potentially surprise you with a